Well, hello, it's Bruce Williams again, and today I'm pleased to present the 11th and final lecture in my series on the selected gross pathology of the skin. We're going to talk about neoplasms and a few select non-neoplastic diseases. As I do at the beginning of all of my lectures, I want to thank those friends and colleagues who have provided images over the years which allow me to put these lectures together. The first entity we're going to look at is not a true neoplasm. It looks like a neoplasm. It goes by the name Apocrine cystomatosis, a problem in middle-aged and older cats with a predisposition for Persians or for Himalayans. We see dilation of the apocrine glands, the ones not associated with follicles, in the ears primarily, but occasionally around the eyes and the perioral area. While some vets believe this is strictly a cosmetic problem, others believe there's a connection to cancer in these animals. And obviously, an affected animal like this is going to require treatment. Okay, let's go to one of the most boring non-neoplastic lesions there are, but thankfully, Jim Carpenter took a picture of one back in the early 70s. It's in Noah's Archive, and this is a skin tag or an acrochordon. These are polypoid projections of dermal elements which are limited to fibrous connective tissue core and an overlying hyperplastic epidermis. If you are seeing hair follicles or adnexa within them, you're not dealing with an acrochordon. They often pop up in friction areas, have a thin polypoid neck, but just remember, any adnexa in it is probably a focus of dermal fibrosis and not a true skin tag or acrochordon. Okay, follicular cysts and tumors. That is by far the number one cytologic aspirate we get. People like to aspirate these, and I much rather would see them aspirated than squeezed, because everybody wants to squeeze something like this, and if you get something out, that's a great day. But the problem is, when you don't get something out, you're probably squeezing some of this keratin into the surrounding tissue, and it's going to cause a tremendous granulomatous response. This is going to blow up 2 to 3 times the size and be angry, much angrier than it was when this walked into the office. So a bottom line, which I try to teach all young vets, don't squeeze anything. Nothing good really will happen. You don't have to get this stuff up. Normally there's a complete cyst wall. These are most often seen in the isthmus part, but there are a number of different types, infundibular, isthmus, matrical cysts, and one of the characteristics, which you probably will never get to see, is this lamellated keratin within them, suggesting that this is a follicular cyst. Of lesions, including multifocal areas of dermal fibrosis, which you can see on the legs and on the feet, which are often associated with uterine leiomyomas and renal tumors, cystadenomas or cystadenocarcinomas. It's a classic triad that's been documented in German Shepherds over the years. Okay, let's scoot back to the follicular tumors. And follicular tumors are always better diagnosed by histology than grossly, but it's fun when people send one in that you go ahead and you bisect it and take a nice picture and see if you can figure out which one it is in advance. I think that the easiest one to identify is the infundibular keratinizing acanthoma, or the IKA, because these often will have a thick complex wall and they will have a pore which connects to the surface. If you look at the wall, these little white areas correspond to keratin pearls, which are commonly seen within the wall of IKA. The other two main follicular neoplasms that we will see in dogs are trichoepitheliomas and pilomatricomas. And trichoepitheliomas are second after IKAs. Pilomatricomas are a lot less common, at least in our practice here at the JPC. One of the ways that you can tell the difference between the two grossly is the pilomatricomas tend to be a single large neoplasm, unilocular, versus trichoepitheliomas, which often are have various, sometimes discrete, follicular-like structures within them. It's an attempt of the body to recapitulate follicles. You can usually make your diagnosis at 4x because it has abrupt keratinization changing straight from the very purple basal layer to a central area of pink ghost cells. Now, one thing that I want you to notice in these next two follicular neoplasms, the keratin is granular. It's very disordered. It's not like what we saw back here in the follicular cysts. It's sort of disordered and doesn't have a particular pattern. That suggests that we're dealing with a follicular neoplasm. That's not an excuse for you to give up your microscopes yet, because we always want to take a number of sections of this. Now, one of the issues that we see with the trichoepitheliomas, and a little more often with the pilomatricoma, here's a pilomatricoma. It also has abrupt keratinization, so the wall is generally pretty purple and has this granular disordered keratin within it. This keratin may be calcified. You may see pigment in it, and it appears as ghost cells, sort of degenerate keratinocytes that have sort of broken off and formed islands within the center. But one of the things that you will rarely see with these follicular neoplasms, and we see lots of them, are malignant tumors, especially with the pilomatricomas. They like to invade deep. They will go to the draining nodes and ultimately into the lung. So follicular neoplasms, while the vast majority are benign and well confined to the skin, a couple of them will go bad and they end up in the lungs. Here's an uncommon lesion in the dog. This is a 6-year-old Shih Tzu, and a great picture by Dr. Fabrizio Grandi. And we see these large horn-like projections of keratin. These are cutaneous horns. They usually arise from virally induced papillomas, which we looked at the first lecture in this particular series. So let me see one of these cutaneous horns. You can pretty much guess that the biopsy of the bottom of this horn will yield epithelium with very characteristic coilocytes with a enlarged grayish cytoplasm, and occasionally you'll find the papillomavirus intranuclear inclusions. One of the most common neoplasms of the dog, especially young dogs, but you can see it in all ages, is the canine cutaneous histiocytoma. These arise from dendritic cells in the skin of dogs. They look just like histiocytes. They very commonly have a high mitotic rate. And one of the big things that will confound young residents starting in their residency and their microscopic examination of the world is the fact that follicular tumors, as we looked at, and benign tumors like histiocytomas in the skin often have a very high mitotic rate. The number of mitoses that we see in this tumor far outstrips what we see in malignant melanomas. So don't always equate high mitotic rates with a malignant tendency. This also really confounds human pathologists because they invariably diagnose those as lymphomas. These cells will regress over time. They're usually well differentiated from the underlying tissue as compared to the tumor we're going to look at in just a minute. And I'm a big believer that human pathologists should not diagnose animal tissue, because if all the human pathologists have called this lymphoma over the years if people had taken their diagnoses with a grain of salt, we would have had a lot more dead dogs who, if the owner had waited 4 to 6 months, it would be totally gone. They do regress over time. They're infiltrated with large numbers of lymphocytes and plasma cells. A lot of times you'll get a biopsy that looks like an inflammatory lesion. You have to look very carefully for what I call the potato-shaped nuclei of histiocytic cells or dendritic cells in these particular cases. And one of the keys, or there are a couple keys to diagnosing this. One is they often will have a hyperplastic epidermal covering which has long ridges. These are often ulcerated, so it's not always there. The other thing is that in the ones that are advanced in their regression, at low magnification, the residual inflammation often tracks adnexa. So you need to be real careful with these because there are a couple of things that they can masquerade for. When you go too fast, you might call something a histiocytoma, where it's actually epitheliotropic lymphoma, or it is a cutaneous histiocytosis, which is a neoplastic condition where the animal has multiple of these around. It's okay to have one or two. You shouldn't have crops of them on the head or neck of a dog. And those two conditions can look very much the same. So we're going to see many and many of these every day. If you're in a high-speed biopsy practice, make sure to slow down. You don't want to miss one of these other two bad actors. Speaking of bad actors, here's one. If you look at the cross-section of the histiocytoma, as you see, it's very well delineated from the underlying tissue. This one is not. The whole thing is ooey gooey because there's a lot of edema. There are multiple raised ulcerated lesions on this animal's face, and these are mast cell tumors. Within the last couple of years, within the last decade, Dr. Matty Kupel and a group of representatives from 21 other veterinary schools have come up with a very nice grading system, which broke the previous systems of 3 grades into 2 grades, either high or low. For the most part, the JPC uses this. There are a couple we have found, and we've talked to other vet schools, and they have the same problems that don't quite fit into the classification. But in the vast majority of cases, we're able to identify them as low grade, which tend not to recur with complete excision, and the high grade, which may carry a genetic mutation on exon 8, which suggests that they are more likely to cause recurrence and distant metastasis. I always give a warning on any mast cell. They are highly unpredictable, and mast cell tumors that are low grade, you may end up with them in the lymph nodes or the viscera. And ones that look very high grade, they may go nowhere. So I don't trust any mast cell. I think that they all warrant wide excision with margins exceeding 5 millimeters if possible, and close clinical follow-up. Mast cell tumors also may result in pyloric ulcers as a result of release of histamine, which causes upregulation of acid release from the parietal cells of the stomach, and the ulceration is characteristically at the point where the stomach hits the duodenum, which can take a whole lot of acid. Just one last thing about the diagnosis of mast cell tumors. They can be diagnosed as either cutaneous or subcutaneous. If they are completely restricted to the panniculus or the fat, they don't poke up over the fat, they would be classified as subcutaneous. And a great paper by Jen Thompson many years ago showed that these have a better prognosis than the cutaneous ones. They're not graded out. We don't make them high or low grade. We just call them subcutaneous. And we say that in the vast majority of cases, they are considered to have a better prognosis than the cutaneous forms. That being said, any mast cell tumor can go bad. Another round cell tumor that you will see in dogs and especially good advertisement for the use of gloves. No, you can't really get this, but if you are holding the penis and prepuce of a dog with tumors on it, I think that most people would put a pair of gloves on. But this round cell tumor is the transmissible venereal tumor. You will see it in the paragenital area of dogs, occasionally on the face, and it is the one type of tumor, at least in the dog, that undergoes xenotransplantation. One dog can give it to another by sniffing or licking or coitus. They have an abnormal number of chromosomes. They're derived from histiocytes. They only have 59 chromosomes as opposed to normal 72. And when they are initially transplanted, they don't express type 2 major histocompatibility antigens in any significant amounts. They begin to do that over time, which results in an inflammatory condition, infiltrate of lymphocytes and macrophages, and ultimately regression in the vast majority of cases. Some animals, probably because of quirks in their immune system, will develop disseminated transmissible venereal tumors. They can occur underneath the skin, or they can occur within viscera as well. But in most animals, they will regress over time. Here's a great picture from Dr. Sarang Kanwat at Chulalongkorn University of a dog, and these are all transmissible venereal tumors underneath the skin. Another common round cell tumor in the dog is the cutaneous epitheliotropic lymphoma. These are usually T-cell neoplasms, and the cells will infiltrate the overlying epidermis or the epidermis of the hair follicles, forming nests of neoplastic, sort of bizarre-looking lymphocytes within the epithelium, which we call Potrier's microabscesses. You can see these singly. More often you get a biopsy with a history that there are multiple nodules on the animal. This is always a fairly easy diagnosis to make if you have a working CD3 antigen, and it will nicely demonstrate the neoplastic cells within the epithelium. Now, this is not the only type of neoplasm that will throw its neoplastic cells into the epithelium. We know for many years about melanoma cells, even amelanotic melanoma. You can see little packets of those in the epithelium. Junctional activity is a very common finding in that tumor. Luckily, most of those tumors in the area of the epidermis are pigmented, so you shouldn't have any trouble. Canine cutaneous histiocytomas, those tumors of dendritic cells, will, especially in older animals, infiltrate the epithelium, so don't be thrown. A great marker, at least here at the JPC, for histiocytomas, and I use it more than I thought I would, because sometimes these tumors tend to bleed, and the histologic definition's not very good. Is IBA1. It works great on histiocytomas, and when you get these traumatized round cell tumors, sometimes it's tough to tell a plasmacytoma from a histiocytoma from a lymphoma. Okay, to go back to the T-cell epitheliotropic lymphoma. Oh, and before I leave that, other cells, that there have been mast cell tumors that have infiltrated the overlying epidermis. So it is not the be-all and end-all you need to use, especially when there's a possibility we're dealing with epitheliotropic lymphoma. You got to use your immunos to diagnose these. Another thing that you will see, and this is a picture from Dr. Guillermo Couto, who is an oncologist, professor emeritus now at Ohio State, and he gave me this picture, and he says, when you look at these round cell tumors of the skin, if you just looked at this one, you're going to see a histiocytoma, but when you start seeing donuts, then you got to think of epitheliotropic lymphoma, and that's what it looks like. We have normal tissue here, we have this ring of neoplastic tissue, it looks like a donut. Okay, here it is in a schnauzer. Okay, tough to tell what these are, but look, donuts. Just one more, donuts in this boxer. So look for donuts. It might clue you in that you're dealing with epitheliotropic lymphoma. an uncommon round cell neoplasm of the skin of dogs is one that's most commonly seen in Bernese Mountain Dogs, but you can see it in any large breed dogs. And this has been broken into a number of different categories. It is a generalized histiocytic proliferative disease. In the most benign form is known as systemic histiocytosis or cutaneous histiocytosis, and you see proliferation of histiocytes primarily in the skin and the ocular and nasal mucosa. Whoops, didn't mean to do that. Cutaneous histiocytosis generally does not progress beyond the lymph nodes. It involves the skin and the subcutis. These nodules tend to be wider, deeper in the tissue, and more narrow at the top. They may include other inflammatory cells, including neutrophils, plasma cells, lymphocytes, and occasionally eosinophils. Systemic histiocytosis will have a similar population, but also invades the lymph nodes as well. And then finally, what used to be called malignant histiocytosis is a proliferation within visceral organs as well. And the cells don't look quite so normal. For histiocytes, they have pleomorphic or bizarre forms, and this is why it has now been renamed and reclassified as the disseminated form of histiocytic sarcoma. So these tumors aren't just Bernese Mountain Dogs. You can see it in Irish Wolfhounds, Basset Hounds, and others. And it's a spectrum of disease that a lot of things still need to be worked out. Okay, let's get away from the round cells. We can look at the vascular neoplasms of dogs, the most commonly seen as a result of ultraviolet light damage in the short-haired and lightly skinned areas of the dog, especially on the underside, or dogs. And we like to think that these are, we always joke that these animals are sunbathers, and pit bulls love to sunbathe. And most of what we see here are usually in pit bulls, but any dog can get it. Any dog that they don't need to sunbathe if they are on concrete in an area that's brightly lit by sunlight. That UV light can bounce off of the concrete and reflect up and cause these neoplasms. The vast majority are hemangiomas. We used to split them out into capillary versus cavernous. That really doesn't make any difference. Sometimes we call them angiokeratomas if they involve the overlying epithelium. It really doesn't tend to make any difference. The key is mitotic rate, depth of invasion, and the diagnosis of hemangiosarcomas. Sometimes we'll get 5 and 6 of these at a time. You may have 2 hemangiosarcomas and 4 hemangiomas. The key is complete excision and watching this dog, trying to protect it from ultraviolet light. Only rarely, and ultra rarely, would this represent a metastasis from a visceral primary. And I can't remember the last one that I saw of those. Most of these we tend to believe arise in sun-damaged skin. Here we're looking at the south of a northbound dog, and we can see that there are multiple nodules within the perianal area. These are perianal gland tumors. I don't particularly like the term hepatoid gland tumors. They are hormonal responsive. They tend to respond to testosterone, and the majority of these will be seen in dogs that are intact. However, you can still see them in neutered males. You can see them occasionally in female dogs. 2 have ulcerated here. This dog was probably named Scooter. One has been aspirated here, and you can see these perianal gland. They are modified sebaceous glands, and they get the term hepatoid because they sort of look like hepatocytes under the microscope. But that tends to confuse people who don't use a microscope on a regular basis. So I try and stay away from that. I just call them perianal gland tumors. The vast majority are benign. They can get traumatized and look sort of ugly and disordered. The best way to tell that it's going malignant is if it tends to invade deep. We probably overdiagnosed the low-grade carcinoma. These tumors are arranged with a central area of fully fledged liver-looking perianal glands, which are surrounded by a thin layer of basal cells. And usually it has a very regular appearance. Sometimes the basal cells will be a little bit more, they'll be very disordered. And I think to be on the safe side, we call them low-grade carcinomas. We probably overdiagnosed this because I was told by Mike Goldschmidt that these malignancies are very, very uncommon. Of course, the thing that everybody worries about when you're dealing with, I forgot to mention that these aren't just restricted to the perianal glands. You can also see them along the dorsal or ventral midline. So you'll see them in the prepuce of males. You can see it at the tailhead or up over the back of any type of dog. So if you see one that says it's in the center of the back, don't worry about it. Still perianal glands. The thing that everybody worries about when we talk about glands around the anus is the bad actor of the two, and that is the apocrine adenocarcinoma of the anal sac. These arise in the anal sacs. The anal sac is lined by apocrine glands, and they will occasionally become neoplastic. And I don't know if I've ever seen a benign neoplasm of these apocrine glands. Only the carcinomas, and they do a lot of things. The first thing that they do is they metastasize. In this case, we're looking at, this is a great picture from Dr. Paul Stromberg, and we're looking at the paired anal sacs here. One has a neoplasm, here's the rectum. The first thing that they are going to do is they are going to metastasize to the sublumbar lymph nodes, even before the veterinarian or the owner notices that there is any problem and gets the animal checked. Eventually this animal is probably going to have some pain or a difficulty defecating, and when that happens, it goes in, it gets a rectal exam, they're going to feel something, and it's already in multiple lymph nodes. These are bad actors. In addition, these particular tumors will produce a parathyroid hormone-related peptide, which causes hypercalcemia by stimulating PTH receptors. It's not really PTH, it's a related protein, but it'll stimulate the PTH receptors in bone and kidney and cause a marked rise in hypercalcemia. This is one of the classic causes of hypercalcemia of malignancy, first identified by Don Mutin back in the 1970s. So apocrine adenoma of the anal sac. Eventually these will become palpable and people will be able to aspirate them. The aspirates of this, and we get a lot of aspirates of perianal masses, and they look very different. You will see acini in here. The cells are much smaller. You will see these spherules, which are three-dimension result of the acini, and you may see a lot of naked nuclei in the aspirates of the apocrine gland of the anal sac, which you don't see with the perianal gland tumors. Lipomas. I didn't show you the regular lipoma. I think everybody knows that. Just remember there are a number of other types of lipomas. You have the infiltrative lipomas, which will go ahead and infiltrate underlying muscle. And sometimes you just get lipomas that are shelled out, or most of the time you get lipomas that are shelled out. And typically, even if we don't get the borders, we say that the vast majority of these will, are completely, even though incompletely excised, will never be heard from again. One of the problems is you don't really know if they're going to be infiltrative into the surrounding tissue. And if it's in the muscle, that's not a good thing. It's probably going to come back. You also have intermuscular lipomas, which infiltrate. This one is an infiltrative lipoma. It's separating muscle bundles. The intermuscular ones, generally in the dog, appear in the muscles of the hind leg. They dissect in between the actual muscles, and they are the devil to get out if you ever get them out. So with the infiltrative lipomas, eventually you're going to lose function of that muscle. It has to be completely removed. The intermuscular, you have to dissect between all the muscles, see how much you can get out. Infiltrative lipomas can actually infiltrate bone. The vast majority of lipomas are seen in middle-aged dogs, are not associated with obesity. Anybody can get one. Okay, this is sort of a tough one, but This is probably a large breed black-coated dog. This is from a Labrador retriever, and you can see that there is a neoplasm with these sort of proliferating fronds of epithelium within the neoplasm itself. You can see some that are growing out this way, and this is a squamous cell carcinoma. Squamous cell carcinomas are not uncommon, as are a number of other tumors of the toes. We can see keratoacanthomas, which are sort of a benign variant. Squamous cell carcinoma has been associated with a number of papillomaviruses, and we always want to remember the connection between papillomavirus and malignant squamous cell tumors. Another neoplasm that you will see in the toe of dogs is melanoma. Oddly, melanomas of the toes tend to metastasize much more widely than those of the rest of the skin. Whenever I hear about a melanoma on the toe or a melanoma of the oral cavity in a dog, I'm always immediately concerned because of the high potential for metastasis and malignancy. Well, let's move on to kitty cats. And here's a very angry looking cat, and I'd be pissed off too if my owner had let this get so bad. But maybe this was a feral cat. There's a large ulcerated area at the nose. Whenever you see this in a cat, you have two big rule outs. One is going to be squamous cell carcinoma. Much more common in lightly skinned cats, usually UV damage. You also can see them at the tips of the ears. The tips of the ears will be gone and just sort of necrotic. And if you have a white-faced cat, that'd probably be number one. The other one that you always need to think about is cryptococcosis. Definitely very invasive in and around the nose. Will go straight up the nose into the brain of some affected cats. So those would be my two rule outs. But since this animal has a white nose, I'm leaning toward squamous cell carcinoma. It does not appear at this point to be associated with papillomavirus antigens. I'm not sure how many people are working on that, but we know that ultraviolet light can be a cofactor in potentiating the propensity for papillomavirus to transform papillomas into squamous cell carcinomas. One of the most tragic things that has happened to the veterinary field in the last 30 years is the propensity of cats to develop very, very aggressive sarcomas as a result of routine vaccination. I've always said that a cat will try to respond to any routine inflammatory response by turning it into a malignant tumor, and maybe 1 in 10,000 or 1 in 100,000 cats are able to do that with a simple vaccine, and the vet's just doing what they're supposed to do and what we're supposed to do by protecting animals from disease. And it's been associated with a number of vaccines. There have been a number of protocols now that have been put forth, including some people advocating vaccinating cats in the tail. And by God, if you can do that, you're a better veterinarian than I. But it's a reason that people use the back legs, because those can always be amputated. In the rare cases in which this happens, you always put one type of vaccine in one leg and one type of vaccine in the other. I've been so long out of practice, I don't know which one goes on the right leg, which one goes on the left leg, and all of these should be reported. This particular animal, someone gave it a vaccine in the shoulder blades, which is obviously the easiest way to deal with a fractious cat, but you can't amputate this part of the cat. The big problem is you have to amputate these because they are so aggressive. And a lot of cats that you amputate their leg, they're going to develop it at the stump. This particular cat had multiple metastases within visceral organs, including the liver and kidneys. Very aggressive tumors, vaccine-associated sarcomas in dogs. We see this occasionally on cytology as well. The cells tend to have a lot of anisokaryosis, anisonucleosis, and not too difficult when you get the history that it's in a vaccine site and you get these really bizarre spindle cells. Although cats, people that have looked at these have found just about any type of mesenchymal cells. A lot have been diagnosed as fibrosarcomas, but there have been leiomyosarcomas. There have even been a number of vaccine-associated lymphomas in this species. So give a cat a good inflammatory response, which is what you're trying to do with a vaccine. It's going to give you a malignancy. Here's a great neoplasm of cats first diagnosed, or at least reported, up in at the University of Pennsylvania. And I always say it's usually always on the ventral abdomen of cats. I always say these cats look like they got run over by a car. It's usually heavily bruised. It is very leaky, and this is a ventral abdominal angiosarcoma. Some people call them lymphangiosarcomas, and they are probably all lymphangiosarcomas. And these red areas are the neoplasm. They tend to, see how wet this cat looks. They leak a lot of high protein fluid. These cats can get hyperproteinemic. They certainly, when you buy a new white bedspread, they will make a beeline to lay on that and turn it into a total mess because they're always leaking fluids. It's not really something that you're going to be able to excise, and sort of tragic for these particular animals. And one other thing, it's not neoplastic, but this animal probably had a neoplasm. It's a paraneoplastic condition, and cats will develop two different types of paraneoplastic alopecia. One is associated primarily with pancreatic tumors, and this is a dermatitis in which the hair falls out and the skin looks absolutely clean and shiny. I think it's been seen in liver tumors as well, but this is paraneoplastic alopecia in cats, probably as a result of pancreatic neoplasia. They will also get an exfoliative, sort of shaggy, seborrheic dermatitis where the hair falls out, but it's not clean like this, and that's associated with thymoma. And we've looked at that in an earlier lecture, associated with thymoma in rabbits, and cats will do that too. Hey, let's move on to the horse. And squamous cell carcinoma is certainly the number one neoplasm of horses. You can see it in multiple areas of the body. You can see it in and around the eyes. It's more commonly seen in light-haired animals because of the effect of UV light, but there's been a lot of research done recently, especially in the paragenital areas, in the sheath, the prepuce, the head of the penis, the vulva, in animals, where it's been shown that equus caballus papillomavirus 2 has been, and it's not the only one, but this one that has been cultured out of the majority of these paragenital neoplasms. So paragenital squamous cell carcinoma is not an uncommon thing. You got to think about equus caballus papillomavirus 2. Papillomavirus 1 causes these little papillomas on the face and on the oral cavity, little cauliflower-like growths that tend to regress. But papillomavirus 2 will cause papillomas, which ultimately may go, especially in animals getting a good dose of ultraviolet light, to frank squamous cell carcinoma. When you look at a lesion like this, it's incredibly erosive and invasive. On the penis of a horse, I don't think you are going to mistake it for a couple of your other commonly seen lesions of the horse penis, which would be sarcoid, tend to be a lot more proliferative, not so erosive, and maybe summer sores because the flies like to lay their larvae in areas of moisture, and the tip of the penis is generally moist in a horse. I don't think you're going to make that mistake. Squamous cell carcinoma, when we talk about the penis, is number one. Papillomavirus or papillomas are number two. They're probably on their way. And then melanomas are number three. Ponies are a little different. They tend to get a lot more papillomas than the squamous cell carcinomas. That's about the one good thing, the one hopeful thing I can tell you if you own a pony. Everything else is bad. Melanomas. Melanomas, here's one in the ear, especially in gray horses. You see them a lot. And the reason that you see them a lot in gray horses is gray horses, as opposed to brown horses, can carry a lot more melanoma. The gene that goes toward graying of the hair also goes to the development of melanoma. But a brown horse that develops a melanoma tends to get sicker faster, and they tend to be less, well, the course of the disease is much longer in gray horses. They tend to carry a lot more. They often will start around the perineum or the paragenital areas, and they will involve the hind end of the animal. They will infiltrate or metastasize to local lymph nodes in the back of the animal. Here's one that is working its way up on either side of the musculature of the tail. and then eventually it's going to metastasize through. But if you have a gray horse, it's going to tolerate this for some reason a lot better than if you have a brown horse. It's a very common neoplasm in horses. You can see melanocytomas, and we'll see a couple in other species. Here is one in a young calf. You can see them in certain species at a very young age. Usually if you see them at a young age in a calf, they tend to, or a pig, they tend to regress. This is a type of reddish pig called a Sinclair miniature swine, which spontaneously develops cutaneous melanomas at a very young age and sometimes are born with them. The vast majority of these tend to regress. Here's just a closer picture. They may metastasize to a local lymph node, and then lo and behold, 4 to 6 months of age, they've all regressed. So this has been an animal model for many years, a Sinclair mini pig. Going back to the horse, another neoplasm of the skin that is often seen, especially in female horses, is a subcutaneous non-epitheliotropic lymphoma, which under classification is most likely a T-cell rich B-cell lymphoma. These are B-cell lymphomas that just call in a lot of T cells. So the vast majority of cells in there are going to be T cells, but the B cells that are actually neoplastic. This is a waxing and waning lymphoma. Affected animals will often live for years if they get pregnant. It seems to be somewhat hormonally responsive. So animals that are pregnant have a lot of circulating progesterone. The lymphoma actually gets better. The tumors arise along lymphatics. They rarely involve the deep dermis, and they may ultimately go to lymph nodes, but they usually don't go into the viscera. You can see, going back to that progesterone, neoplastic cells are often positive for progesterone receptors, and so regression of the disease has been seen in pregnancy and removal of ovarian tumors that secrete estrogen or testosterone. This is one that you got to look very closely because it's T-cell rich B-cell lymphoma. You are likely to mistake it for inflammation on histo, but the history that the animal has multiple lumps and bumps throughout the body, especially on the front half, is going to make you at least momentarily consider T-cell rich B-cell lymphoma. It used to be called equine cutaneous lymphohistiocytic lymphoma, but then we got immuno and we realized what we were calling histiocytes were actually B cells. Cutaneous lymphoma is seen in a number of species. In the cattle, it's one of the 3 forms of sporadic bovine leukosis. It's not virally induced. It generally affects young cattle between 2 to 3 years of age. It could be either T or B cells, and it occasionally involves superficial lymph nodes, often with translocation of neoplastic cells to the internal organs. This is the one that you get one within a herd, and it's not associated with viral infection by bovine retrovirus. And just a cut section. This particular case was a B-cell lymphoma in cattle. Moving on to avian species, let's stick with the lymphoma milieu, and we will say that this is follicular lymphoma. We talked earlier about the 2 types of diseases of the skin in chickens, those that affect the follicles and those that affect the inner follicular area. This one, you can obviously tell it affects the follicles. All the follicles in this buck chicken are big. They are distended by neoplastic lymphocytes. This is a very characteristic finding associated with Marek's disease, an alpha herpes virus, avian alpha herpes virus type 2, which goes after a number of species and characteristically likes to hit the follicles, whereas lymphoid leukosis pretty much leaves them alone. There are a couple of places that Marek's likes to hit that lymphoid leukosis doesn't. The eyes, especially the iris, the follicles, and the nerves, especially the sciatic nerve. So some people say, well, they're not truly neoplastic. This is a follicular and perifollicular lymphocytic folliculitis. Okay, if you want to do that, but I just call it follicular lymphoma. Write down Merrick's disease, and I will drive on this gross diagnosis. It's amazing. What's amazing to me is how quickly we can get chickens to market. Nowadays, we're getting chickens to market between 8.5 and 10 weeks of age. That's amazing, to take a chicken, grow it all the way up to what you can eat in that short amount of time. But even in that short amount of time, these animals can develop certain types of tumors. Okay, one of the things that are seen in broiler breeders and may have a genetic basis is a tumor known as a keratoacanthoma. I find it very difficult to grossly differentiate these from squamous cell carcinomas histologically as well. If the tumors do not coalesce, they can be trimmed and the carcass can be sold. Unfortunately, if they do coalesce, then the carcass is usually condemned. So it does have an economic importance. They're superficially invasive tumors. They don't metastasize, and that may simply be just a time thing where the animal doesn't live long enough for them to metastasize. They're usually seen in young birds. They're rarely seen in older chicken. They often arise at the base of feather follicles and are filled with abundant keratin debris. So these are keratoacanthomas. One, trim it, drive on, you're going to eat that bird. Multiple ones, when they coalesce, the whole bird's going to take and be condemned. Melanomas, not uncommon in certain types of birds. No big difference than many other species. Some will be benign, some will metastasize to internal organs. Hey, let's look at some of the interesting skin tumors of some lab animal species and maybe an exotic species or two. One of the more interesting ones is one that has been seen in hamsters. Years ago, a man named Coggins was raising hamsters, and he noticed that about 25% of the young hamsters were dying of severe diarrhea. And he was able to identify a polyomavirus. Back in the days, they called those papovavirus. Papillomavirus, polyomavirus, and vacuolating virus. Now they've split them out. And we still occasionally see cases of hamster polyomavirus. In young animals, they were unable to actually get active virus out of the young animals, and they would always die. They would develop these tremendous lymphomas within the gut, which were non-perpetuating as terms of producing virus. And 25% of the animals will develop lymphomas involving the lymph nodes and the GI tract, have severe diarrhea, waste, and die. Interestingly enough, when injected or inoculated into adult hamsters, instead of causing the lymphoma, it would cause the formation of large numbers of follicular tumors, which would produce the virus. So these are all filled with virus. These are trichofolliculomas or trichoepitheliomas, and the animals develop this type of tumors, which do contain infectious virus. Hamsters also will get T-cell epitheliotropic lymphomas. These are sporadic. They're not associated with any type of virus, and that would obviously be differential for polyomavirus infection. We see 1 or 2 cases of this in hamsters still today. Rabbits, if you think about rabbits, the first thing you want to think about is trichoblastomas. These are the most common cutaneous neoplasms of the rabbit, very well delineated from the underlying dermis. Trichoblastomas, always in the dog or cat or the rabbit, have a lot of collagen, so they're hard neoplasms. And this is top of the pops for rabbits, although about 10 years ago, a very nice paper came out describing lymphomas, cutaneous lymphomas in rabbits. And I guess the one that you want to remember, that is a T-cell rich B-cell lymphoma. There's a picture from that paper in veterinary pathology, once again from the University of Pennsylvania. T-cell rich B-cell lymphomas in pet rabbits. We looked at the cutaneous organs in the Shih Tzu. Well, a species that develops a lot of this is rabbits, especially cottontail rabbits. And this is a papillomavirus. We talked about papillomavirus and the formation of cutaneous horns in the dog. This is the Shope papillomavirus. Shope was a researcher, did a lot of virology work at NIH, got a number of rabbit tumors named after him, including the Shope pox virus, which causes Shope fibromas. And this was a Shope papillomavirus. And a number of rabbits which have the papillomas will ultimately get these tremendous cutaneous horns, and this probably has given rise to the legend of the jackalope. Although you can buy a jackalope now for a couple $100 in any cheesy tourist store in Texas, the true ones are cutaneous horns. It's also, when injected into laboratory rabbits, it's a great model for viral-induced malignancy. It tends, while it's benign in the wild cottontails, it tends to be malignant in lab rabbits. So it's a model for viral-induced malignancy, and also those animals become hypercalcemic. So it's hypercalcemia of malignancies as well. In cottontails, usually they undergo regression, or they may occasionally go to malignant tumors. It's not a very good picture. It's a guinea pig. This is a trichofolliculoma. Of all of the species I know, the only one that routinely gets trichofolliculomas. Notice I haven't mentioned that before. This is a special type of neoplasm. It has a central pore, and around the pore it has all the features. It tries to make all the features of follicles and adnexa. So you will see into this pore, you will see follicles pointing. You will see sebaceous glands. You might even see apocrine glands and apocrine ducts in there. Trichofolliculomas in guinea pigs. Mice. Mice have been used in time immemorial to develop tumors. There's been many different ways to do that. A lot of times the animals would be painted or treated with some type of promoter. And this anthracene or benzene or something like that will occasionally cause the formation of papillomas. Nowadays, we have transgenic mice, so we can just go ahead and knock out anti-tumor viruses or whatever, or anti-tumor genes, and we can get new crops of tumors. The advent of the nude mouse in the early 80s, a T B cell deficient mouse, not T B cell absent, but T B cell deficient, the ability to inject these cells with tumor lines was a major advance in cancer research back in the 80s. But because before that, you had to try to get these to grow in some other animal species, including hamsters, which have cheek pouches, which were immune privileged sites. And you would inoculate them in the cheek pouches. Problem is, hamsters are nasty little buggers who will bite you, very difficult to work with. They have a number of issues, including they're hoarders of food. They like to put food in their cheek pouches. So when these nude mice came in and you could inject them, and they wouldn't react to a great variety of tumors. And now people are being able to harvest tumor cells from actual patients and inject nude mice. Eventually, and those take a while to grow up. Eventually, we're going to get to the point where we can do real-time testing on an individual's tumor cells. But right now, tumor cells are being injected into nude mice, and we can grow up various tumors in the living host. That's been a great thing. Certain strains of tumors or certain strains of mice get certain strains of tumor. This is a classic one in FVB mice. It is a neural crest tumor. They get them over the coccygeal vertebrae and also the pinna of the ear. It's always a good thing to know the various strains of mice, what they are susceptible to. So many of them eventually die of lymphoma. But skin tumors, not always a big thing in mice. If I could give you hours and hours just on various tumors in mouse strains. Here's one. I don't see it all that commonly. This is angiosarcoma, which was in the subcutaneous mouse. These tumors can be induced by genetic manipulation, by chemicals. Usually we see them in the viscera I've seen hemangiosarcomas in the bone of various mice, so I don't have a whole lot of mouse skin tumors to show you. One tumor of the skin, or at least the subcutaneous tissue, that's very well known, is seen in rats. The Zimbel's gland is a combined squamous-sebaceous gland, which is just ventral to the ear. And this, like the mammary glands, like the preputial and the clitoral glands of rats, are always harvested and looked at in various studies in which carcinogens have been applied. They can develop either carcinogen-induced or spontaneous neoplasms of the Zimbel's gland, and they can be large, ulcerated. Usually it's the sebaceous part that becomes the more neoplastic. Looks like a big, ugly sebaceous carcinoma. They can become ulcerated, which makes them look worse, but they're very characteristically just beneath the ear. Zimbel's glands tumors. Okay, moving on to ferrets. Ferrets get a lot of skin tumors. Luckily for ferrets, 95% are benign, even the ones that look really ugly. The most common one, and one of my favorite pictures ever taken by an owner, is this particular picture of a sebaceous epithelioma arising from the skin in between the paw pads. Very common, and number one in ferrets are sebaceous epitheliomas. If you want to call them sebaceous adenomas, that's fine too. If they have more than 50% reserve cells and only scattered sebaceous differentiation, I usually go with epitheliomas. Never seen one. These are supposedly low-grade malignancies in dogs, and I've actually seen one go to a lymph node. I usually consider them benign, and I've never seen one metastasize in a ferret, but they certainly, when they get beat up, can look awful. Whenever someone tells me that their animal has been bitten by a brown recluse spider because they have this big swelling and a necrotic area in the middle, I always know that's a sebaceous epithelioma. When the more you beat them up, they look ugly. And a general rule in ferrets is the uglier tumor looks in the skin, the more likely it is to be benign. So this is the one that they call, and they say it's a brown recluse spider. This one, the vet almost enucleated. They thought that this was the eyeball, and it was just a big scabby mess. And then they cleaned it up. It was something like this. They sent me a quick picture. I said, don't enucleate. This is just a sebaceous epithelioma. You can take it off. They preserved the eyelid and the eye. The animal did fine. This is one I just got maybe 2 days ago in my Send Me Your Ugliest Sebaceous Epithelioma pictures. A lot of times, and this is just going to be a sebaceous epithelioma. This animal is going to require surgery, probably going to have to take out some of the skin here, and it's going to have a surprised look on its face for a while, but I have no doubt that this animal will do just fine. So the uglier the neoplasm in a ferret, the more likely it is to be benign. All the other skin tumors that we commonly see in ferrets are mast cell tumors. They tend to look flat and scabby. They're not big and raised and ulcerated like in dogs. And the nice thing about ferret mast cell tumors are they are benign. We know a ferret is not a dog, it's not a cat, it's its own species. They are very well demarcated, they're very bland mast cells, no eosinophils, and they don't go anywhere. So you just take them off and wait for the next one. The only time that you tend to have a problem is, look at how I'm manipulating these, fantastic for me, is when the animals have large numbers of them. They are peritic, that's why they get scabby. Not sure exactly what to do with this particular animal. All these were mast cell tumors, but this is the vast minority of cases. The usual ones are one or two isolated. You take them off, you might get another one, but they don't really cause any problem. Apocrine gland cysts. Apocrine gland cysts, That's the problem of fixing these on the fly. Apocrine gland cysts are not uncommon in ferrets. We looked at cystomatosis in cats, and you can see these little swollen cysts. People come and they say, oh, they look like little BBs under the skin. I've even had people say, my neighbor shot my ferret with a BB. They're most commonly seen where you have high concentrations of apocrine cysts in any species, but especially in ferrets. These are the head, the neck, the prepuce, and the paravolvar region. Well, they're normally scent glands, so you would expect most of the disease to be there. These are some little BBs that were removed with the overlying prepuce of the ferret. The vast majority of these lesions you're going to see are apocrine cysts. Rarely you'll see apocrine adenomas, and the only significant cutaneous malignancy that you will see in ferrets is the apocrine adenocarcinoma, most commonly seen in either the preputial or the perivolvar area. And that's where I see the malignancies. Haven't seen them around the head. And here's an animal that was taken in very late. They were able to remove these large apocrine glands from around the prepuce. But the problem is that by the time you get to them, they usually have metastasized internally and often to the lungs. So apocrine adenocarcinoma, one of the bad actors in ferret skin and usually in the perigenital areas. Ferrets got a lot of other tumors. Here is one that arises from hair follicles. This is the so-called piloleiomyoma. This one probably histologically was read out as piloleiomyosarcoma, but they don't go anywhere. They come, you see them usually around the head, close to the midline where the piloerector muscles are. They arise from that, although they may sometimes, smooth muscle tumors can arise anywhere because you always have smooth muscle in your blood vessels. But this was a piloleiomyoma or leiomyosarcoma. They don't go anywhere, and I think that the diagnosis of leiomyosarcoma was given simply because there was atypia of the nuclei. And here's another one. Spindle cell sarcomas or mesenchymal neoplasms, generally in and around the face. They are of peripheral nerve sheath origin. Ferrets get a lot of them, but remember that around the face there are lots and lots of little nerve endings, especially around the eyelids. And I see a lot of these around the eyelids of ferrets, and this was a ferret that was actually named after me. This was Bruce Bruiser, and he developed a spindle cell neoplasm of the face, and you can see they did a pretty good job of sewing this guy up. But unfortunately, they didn't get all the tumors. And one of the issues that you see with spindle cell sarcomas that you unsuccessfully remove is the more that you go in and try to remove it, the worse they get. So this was Bruce Bruiser shortly before he was put down when they realized they were never able to get that tumor out. You could see where it continued to grow even more rapidly, ripped out the stitches. So spindle cell sarcomas in ferrets, if they're on a limb, you can amputate, and that often is the best way to go. But something like the face, that's a tough road to hoe. And I promised you one exotic animal, and the one I'm going to give you is the Tasmanian devil. This is a transmissible tumor that is spread by fighting. So you get a lot of tumors around the face of these animals. It's thought to be of Schwann cell origin. They're very aggressive, and they're of great concern as they may result in the extinction of this particularly unusual animal from down under. We are hoping that there's a lot of work being done. Nobody wants to see an animal go extinct by a xenotransplantable tumor. Vaccination protocols are being worked up to try and vaccinate animals against this particular tumor, but it's of great concern. It's an amazing type of tumor. Xenotransplantation is not a common thing. We've seen it in transmissible venereal tumors in dogs. We've seen it in a number of fish and mollusks, but not in a whole lot of mammals. And it's something that you always have to be concerned about if something like this got loose in the human population. Okay, well, that brings us to the end. It's been about an hour, and thank you so much for hanging in there. I appreciate you watching this lecture and any other lectures in the series that you hope to watch. I only have a couple more series left, and then we'll have done all the major animal species and the major systems. And then as time goes by and I add additional materials, I hope to go back in, re-edit those, drop some new stuff in. So this lecture, the next time you see it, may have a couple of great new pictures and great new entities. I don't intend to let them remain static. I just have to learn a little bit more about editing these videos. Okay, that's it. Thank you so much. Have a great day. I wish you wonderful health, and I'll see you next time.